Hi guys, it's Sarah. Ugh. I was like a few months. But we're good.
It just means we're young.
I'm still going through puberty. Okay. Hey guys, it's Sarah from the Dainty Pear, and I'm here with Melissa Chappell, right?
Yes,
Chappell.
good job.
Oh,
yes.
good.
People like to say Chappell, but
Chappell, it's very
I'm not
French.
related to. Mine's British and Chappell is French. I'm British.
She's
Chappell.
British.
But I wish to be French.
I could go off about all of her accolades,
My problems.
but I'm just gonna let her introduce herself, and then we have some questions that you guys asked on Instagram stories about becoming a doula. I became a doula from Melissa a couple of years ago, and now I'm in her midwife assistant training. She's just gonna introduce herself and then we'll answer some questions.
Hi, I'm Melissa. I am a certified professional midwife, and I'm licensed with the state of Utah to practice midwifery in a birth center or anywhere outside of the hospital. So yeah, I'm excited to hear your questions. Oh, I'm also a doula trainer, and
Oh yes.
I own this like food business and some stuff.
Not just a food business, we'll have to get into it another time because it's a mile long, but she has cookbooks. She's a super good cook. She's so much fun and darling, and you guys are gonna
You're
love
so
her.
nice.
Okay, the first question was, do you have to become a midwife assistant before you can become a midwife?
No. The midwife
Okay, no.
assistant training is a really good step toward becoming a midwife because it kind of gets your feet wet, gets your foot in the door. But lots of people just start school or whatever path. There are several different paths to midwifery, and a lot of people just start their path and they maybe have only been to a couple births, and then they go from there.
Yeah, I think
So,
we should
yeah.
talk about that another time because I was blown away to know how many paths there are.
So
to
many
becoming
paths.
one.
Yeah.
I am still deciding what I'm doing, but I felt like it was a good step towards it and only deepens your knowledge to have that class.
Yeah.
Do you have to be a nurse for your training? Bye.
No. Well, so it depends. Again, this goes back to the several different types of midwives. So there are midwives who are CNMs, that's a certified nurse midwife, and they practice largely in the hospital, though some states allow CNMs to practice outside of the hospital. So if you're going to be a CNM and you have hospital privileges, then yes, you have to become a nurse first, and then you go on and do an additional midwifery training. If you're going to be an out-of-hospital midwife like myself without hospital privileges, then you don't have to be a nurse first.
Okay. And I have had you guys ask if I'm a nurse. I'm not a nurse.
Like my pathway to training was just completely midwifery specialized.
Okay.
So no nursing involved. Obviously we do nursing things. Yeah.
Okay. How does someone become a doula?
It's actually so easy. It's so much easier than people think. So I am trained by the national organization called Doula International. They're kind of the gold standard, I would say. There are lots of other great trainings out there, but of course I'm partial to them. They've been around the longest. They're actually the organization that that coined the term doula. So they're legit. They're solid. They've been around for about 20 years. So I'm trained with DONA, and with DONA you have to take a training, an in-person training, and it's about 2 to 3 days depending on who you take it from. And then you do a series of steps towards certification after that, like reading books, taking a childbirth class, taking a breastfeeding class, and then attending births as a trained doula but not yet certified. And so it's actually pretty easy.
Yeah, I would say the training part is easy. I think the tricky part comes when you're trying to get your births.
Yeah.
It takes
You have to
time.
get three.
You have to get three
births.
births. Fill out all of your paperwork. It's just a lot of follow through.
There's a lot of paperwork and a lot of like steps, but they're all easy. Like the process is like maybe
straightforward.
Yeah.
Just getting the births. I feel like if you don't know a lot of pregnant people, it might be the hard part.
Yeah. If you're really awesome, then we have people come to our births with us to help them get their births.
They'll help moms have a doula be provided for them.
Yes.
Okay, what's the difference between a midwife and a doula?
That is a great question, and one I get all the time. So here's the super straightforward, simple answer. A doula doesn't do anything medical at all. A doula is a non-medical part of the birth team. They don't do anything clinical. Yeah. So emotional, physical, and informational support is what I say a doula does. A midwife is in charge of the clinical aspects of the whole labor and birth, the prenatal period, the postpartum period. She is in charge of the health and safety of the mom and the baby. And of course midwives also give physical, emotional, and informational support, but we go a step beyond and do medical things.
Yes.
So it's way outside the scope of a doula to do anything medical at all.
Yes.
So this is like what doulas do. They just like love,
Let me
give you
touch you.
massages and say you're doing a really good job and stuff like that. So.
Yeah. Oh shoot, I had a really good thought and just ran away.
About how amazing doulas are.
Oh yeah, as a midwife, do you like having doulas at your birth?
I love doulas so much.
She loves
My
them.
partner's like sitting over there, and I'm positive that in her mind right now she's like, yes. Doulas also.
Yes, we love doulas.
Yeah, so doulas, the midwives' brains really have to be turned on and fresh because especially when it gets toward the end of the birth, that's when all of, well, not everything, but you really have to be on your game at that time and really watch for every little nuance in and heart tones and blood pressure and vitals and all kinds of things. And so we love doulas so much because they kind of help us do that brainless part. That sounds mean, but
No, I get it. It's fine.
But you don't have to think a lot to
Yes.
be a doula. You have to use your hands a lot, and it's a lot of physical work, and you have to give a lot of encouragement. But that doesn't take like computation
Well,
or anything.
the mom and baby's life is not necessarily in your hands. It's in the midwife.
Exactly, yeah. So you can just focus solely on the mom and helping her get through every contraction and helping her know she's doing an amazing job and stuff. And so I love that we can have the doulas show up first, and then I can come in when things start getting into an active pattern, and that's when I can really like go, okay, I'm ready. My brain is on because I'm fresh because this doula has been working with this mom for these hours, and now
I agree. And midwives are great too because you really are hands-on and try and be in the birth,
Absolutely,
especially in the
yeah.
birth center. They're around.
Yeah, we usually join women in active labor, and if it's a very, very long labor, for example, like over about 24 hours or so, then we will take turns with helping each other sleep and things like that.
That's awesome. And they do have They do have two midwives here.
That happens.
Yes, sometimes you do. How would you go about choosing whether you want a midwife or an OB?
That's a super good question. So a lot of people don't know this, but OBs are trained surgeons, and they're trained in high-risk birth. And the biggest difference between midwives and OBs is that midwives are trained in normal, low-risk birth. So we both specialize. So of course, we know how to notice and deal with many complications. Once it goes to a certain level, then we're really thankful for OBs, and we're thankful that they can help us take care of those more difficult high-risk problems. So if a mom comes to us and let's say she has heart disease, or she's had kidney disease or cancer or lung issues or anything like that, we don't take those people. We do not specialize in those people, and that's why we're so thankful for OBs, because OBs then specialize in high risk birth, and they are surgeons. They're trained surgeons. We are not trained surgeons, but we are amazing at normal physiological birth.
I feel like I've had that question a lot too because I do prefer to be in a hospital with an OB, but I love it.
You also have a really great OB that you work
Yes,
with.
yes.
Your OB is, from what I've heard from all your birth stories and your birth videos and stuff, your OB is very good at treating a low risk situation like a normal physiological process, instead of doing what sometimes we see happens with OBs, where they sort of apply all the high risk things to low risk clients. And your OB is like really good at just keeping it chill and low risk, and like this is a normal woman giving birth. So
yeah. This was a good one. As a doula or midwife, are you forced or told to comply with CDC recommendations?
Yes, we're not forced. It depends. It really depends. With being a doula, I'm gonna like move it to OSHA here too. So CDC and OSHA. The CDC is always a recommendation. So even if you're a provider in a hospital, you don't have to follow CDC protocol. So there are certain things that we absolutely follow CDC protocol on, but we always give the choice to we call them clients, OBs call them patients. We always give the choice to the client, because let's say we have something like GBS, for example. The CDC recommends that we treat GBS with IV antibiotics, and not all of our clients want to do that. So we give our clients all of the information. We say, here's the recommendation, here are the risks, here are the benefits, here are the alternatives, here's what we think would be a good idea in this situation, in this scenario, and then the client is the ultimate chooser of what happens in that situation. But no, we're not. The CDC is not a law-making organization.
Okay.
So yeah.
And I think that's the difference too. If you are choosing a birth center, choosing a midwife, that's a big part of the initial process of hiring your midwife, is making sure you are comfortable calling some of the shots and
you have to be a responsible person if you want to go this route. You have to be willing to take responsibility for your health, and other things. And as far as doulas go, doulas wouldn't really, they never go into that scope where they would have to ever consider anything that the CDC ever said.
What's the difference between a midwife assistant, a doula, and like a labor and delivery nurse?
Okay, so you would never see a midwife assistant in the hospital. So that we have midwife assistants working with us outside of the hospital, and they do some clinical things. Most midwife assistants have had training, or they've apprenticed, or they're working toward becoming a midwife. So under our supervision, they are allowed to do clinical things. And they will definitely sometimes go outside of that clinical scope and do doula stuff. But they will mostly act as an assistant to us. So they'll draw up medications for us. They'll help clean up. That's a huge one.
Yes.
So exciting. Be a midwife assistant. You get to clean up
placenta
all the time.
How do I look for the best doula for me?
Ooh, that's a good question too. These are really good questions.
And there's like
a million. You have so many more.
We'll have to do part 2.
Yeah, let's do part 2 and part 3. And so there are so many great doulas out there, but I can't say, oh, choose this one because she's the best ever, because different personalities work well with different people. So I always just recommend just chatting with a few of them. We're all the doulas and midwives, we're all used to people doing consults with us. And I don't know anybody who charges for consults. There might be some people out there, but you can set up an interview with a doula and just get a feel for whether or not she's the right fit for you.
I never feel pressured to go with the first one.
Never. And we always, like if people come and talk to me about being a midwife, I say, I encourage you strongly to go check out a few other midwives to make sure that
go make sure that I'm
your
the
best fit. Yeah, go make.
What place would you recommend if I wanted to become a doula? I think this is the perfect ending question.
So there aren't really any places that you go to become a doula, although Salt Lake Community College did have that program for a little while. But what that program was, it was the same thing that I teach over the 2 days, which is about 24 hours worth of training, just spread out over a semester. So it's the same exact thing if you come to the in-person training.
Okay. And then the one that she teaches is like 2 to 3 full days.
Yeah.
You're just packing in all the information.
Yeah. So it's pretty much the same thing. So, and if you're not local, if you're not in Utah, I have people fly in for trainings all the time, but if you're not in Utah, there are trainings all over the nation. And should I say the resource?
Yes.
Dona.org.
Yes.
DONA.org. And you can type in your zip code and you can find a training near you.
Yep. Thanks. We're so happy to have Melissa here. We'll do part 2.
It was